Hey, it's Dave here, and in this video we're going to continue our discussion on medical testing and all the technology that's available to try and help us figure out what's going on in the digestive system if we have a bunch of symptoms in there. So this particular video we're going to talk about imaging and scanning techniques, and a lot of it is really repetition. The imaging and scanning techniques are really helpful, a little bit like ultrasound and endoscopy and things, but they're really kind of looking at similar things. They have the same drawbacks, and the main drawback is that they don't necessarily get to the underlying reason for the problems, and that they can actually detect problems that are quite well advanced that may well need treating, but we may need to look several levels deeper to find out what caused those other problems. So we have different types of imaging and scanning. We have CT scans, we have MRIs, we have X-rays, we have virtual colonoscopies, and we have radionuclide scanning as well. And what are they good for? Well, they're really good for finding structural abnormalities in the tissues and the organs. So they're great for finding things like abscesses and cysts. They're great for finding polyps and ulcers and things like cancer tumors as well. They're great for detecting an enlargement in certain organs such as the liver, the spleen, the pancreas, and what have you. And they're also helpful for finding things like cirrhosis of the liver, which is kind of an advanced liver disease. They're also great for finding obstructions and narrowing and possibly strictures and twists and things in the intestine as well. That's certainly something that I've experienced, but not to a severe degree. I've had work with visceral osteopaths and manual therapists where they've been able to detect just little points where bits of intestine are stuck to each other, and they just need to tease them apart with some gentle manipulation and things. But they can also find these tests severe problems in this regard. Some people do have structural issues that need a lot of care and attention, possibly surgery in some cases. Gallbladder and bile duct problems, so things like gallstones and stones that might be stuck in the ducts or the tubing between the intestine and the pancreas and the liver and gallbladder. And then kidney infections as well, and other kidney problems. You can also find obstructions in the portal vein, which is the main vein that sort of drains the digestive system and sends blood to the liver. And you can also find hiatal hernias. This is a big one. Hiatal hernias can cause a lot of upper digestive problems like heartburn, acid reflux, and what have you. And so you can find the hiatal hernias using these methods as well. And you can find things like colitis, Crohn's disease, diverticulitis, which collectively are called inflammatory bowel diseases. And so there's a huge amount of value in having these scans. Where does the problem lie? Well, for want of trying not to repeat myself from the other videos, the issue is while these tests might find conditions that certainly need treatment, they're not digging in several layers down to find out what caused these problems in the first place. And that's where the functional lab testing comes in. Do you have too much unfriendly microbial activity in your digestive system, or do you have inadequate friendly microbial activity? Do you have a lot of inflammation and problems caused by foods that you're eating or alcohol that you're consuming, which can be detected with things like stool tests and food sensitivity tests respectively. What about things like low levels of stomach acid, for example? Some of these issues are associated with low levels of stomach acid. Where is that being identified with these fancy tests? It's not really being identified at all. So while these tests are helpful, can without question be life-saving in some circumstances, for most of us who are just wandering around with a few symptoms that are making life uncomfortable and embarrassing, with farting and belching and bloating and diarrhea and things like that, in most cases, this kind of stuff is not really going on. So we need to have other sets of testing to be able to find some of these more subtle causes for the less severe symptoms like irritable bowel syndrome and things like that. So in the next video, what we're going to do is look at what the comparison looks like between these kinds of fancy medical tests and also the testing that we typically run in our practice to try and find out what's going on in someone's digestive system. And with the testing we run, are there any red flags that can lead us to refer to the medical system to get some of these more advanced tests done. So I hope that's been helpful, and I will look forward to seeing you on the next video. Thanks a lot.